Hello, everyone. Welcome to episode 19 of the Not A-fib podcast, powered by the Journal of Emergency Medical Services. My name is Mark Flauter. Republicans in Congress see a way around the $880 billion budget shortfall they need to fill to extend President Donald Trump's tax cuts set to expire at the end of the year. States aren't going to like it. To qualify for federal Medicaid dollars, states must also kick in their own matching funds. GOP lawmakers want to stop states from taxing insurers and healthcare providers to raise that money, a maneuver that could leave states with a $612 billion hole in their budgets over the next decade. Republican leaders who are under pressure from some of their rank and file to protect Medicaid say getting rid of the taxes would not be a funding cut, but elimination of a loophole. They argue that states are inflating Medicaid costs because they kick back the taxes to providers and insurers through higher payment rates, and also sometimes spend their money on items unrelated to Medicaid. States and providers scheme so that the provider gets an enormous flow of federal dollars with no state cost exposure, says Brian Blaze, who served in President Donald Trump's first administration and has pitched restrictions on the state taxes at his think tank, the Paragon Health Institute. House Energy and Commerce Chair Brett Guthrie, who's in charge of finding the $880 billion in savings by the time Republicans plan to vote on their budget bill in April, told Politico that he's looking closely at the state taxes. The levies become even more of a target after Speaker Mike Johnson said Congress would not use two other methods the GOP had considered to raise revenue: imposing caps on federal payments based on Medicaid enrollment in states, or reducing the percentage of state spending the federal government matches. Medicaid is funded jointly by states and the federal government. States can draw upon a variety of funding sources, including their general funds. States have used the provider taxes to juice their federal matching funds since the mid-1980s. Barring states from drawing federal matching funds for the taxes would hit red and blue states. Every state except for Alaska levies provider taxes. Republicans are already getting pushback. Last week, New Jersey Governor Phil Murphy, a Democrat, released a report detailing a potential blow to his state's budget if Republicans cut funding to the states, including by restricting matching funds for provider taxes. It's crucial for stakeholders, advocates, policymakers, and recipients to fully understand the potential repercussions on healthcare and services if these proposals are enacted into law, said Cyril Edelman, New Jersey's Human Services Commissioner, in a statement to Politico. We urge congressional leaders to protect the integrity of Medicaid and uphold the commitment to those who rely on it every day. That is an excerpt from an article entitled "Republicans Say States Are Pulling a Fast One on Medicaid," published in Politico, the American political digital newspaper company, by Robert King in February. Joining us today on the podcast is my first returning guest. He was a guest on episode 5 back in January of 2024, where we discussed state supplemental reimbursement programs, and has joined us again today to discuss the many changes that we've been seeing over the last year, and especially over the last 2 to 3 months since President Trump's administration took over. Kevin Fairley is an attorney with EMS Compliance and is gracious enough to join us again today. Welcome back, Kevin.
Thanks, Mark. It's a pleasure. I didn't realize I have the honor of being the first returning guest.
Absolutely. Before we jump into the Medicaid cuts and things that we've been seeing since the Trump administration took over, let's go back a little bit. Last summer, you spoke at the Pinnacle EMS Leadership Conference where you talked about HIPAA and the privacy rule changes that are coming. Can you talk a little bit about what EMS can expect to see, or how those privacy rule changes will affect EMS as we move forward?
Gosh, yeah, I'll have to shift gears a little bit, because we were talking about HIPAA last summer, and now a lot has changed, right? Uh, I guess there's still just so much uncertainty that it's hard to say exactly what's going to happen with those. There have been some changes in terms of and I'm not an expert on all of these things, but in terms traditionally when we have rules and HHS proposes rules, then there's a comment period and there's opportunity for the public to comment on those before they're finalized. That apparently has been removed. Um, and so there were privacy rule changes, and then actually security rule changes, I believe in December. And and honestly, where those are going to end up, I really don't know. I can say that it was my opinion on the privacy rule. The changes is that they had made some good common sense changes. There were things about the privacy rule that were just burdensome and didn't make a lot of sense. And so hopefully we see those implemented. With security, the HIPAA security, really, to me, they just re-emphasized a lot of what was already there, and didn't provide a lot of help for, say, EMS and smaller. Even the biggest EMS and fire agencies are pretty small in the healthcare
Mm,
world, right? And
right.
people just don't have the resources to comply with a lot of this. There wasn't a lot of help there. I think it's just too early to say, Mark. I mean, they just announced this week basically a wholesale restructuring of the Department of Health and Human Services. Um, they are closing down divisions and sites throughout the country and combining those. Um, so in terms of specific, what's going to happen with specific rules, man, I think that's hard to say.
Yeah. Yeah. And I would imagine even more so in the last couple of months since the new administration's taken over.
Yeah, for instance, I know that in the announcement I believe it was this week of the changes they did, it's no surprise that there's a new position that's being created that essentially is a new enforcement, oversight role. And OCR, the Office of Civil Rights, which has responsibility for HIPAA, is under the purview, as I understand, of this new position. So, you know, I think they've got to get that position going before we see exactly what's going to happen with enforcement and implementation of these rules. I certainly think what's there right now isn't going anywhere.
Right.
It may become more burdensome. Um, we'll just there's going to be quite a bit of wait and see.
Right. One of the other things that was discussed at that update is you talked about cyber attacks, and you specifically mentioned a couple of instances where hackers had infiltrated the databases of a couple pretty big name companies affiliated with EMS. For those agencies that are doing a lot, obviously everyone's doing electronic healthcare reports. What are some steps that they can? Are there steps that they can take to protect themselves, or how does that fall in, or how does the HIPAA security apply to those instances where hackers get into the database of a large company?
Yeah, and that's a tricky one too. As I just said, to fully comply with the HIPAA security rule, which is a beast, I think is a real challenge for any EMS agency. Even rural hospitals have come out and said, "Look, we need more resources to comply with this." Um, but there are some steps that you can take. The first thing is a HIPAA security risk assessment and completing that. And there are free resources. Um, I wasn't really fully prepared to talk talk about HIPAA security, but
That's
but
okay.
but but there are resources out there. I can't cite them. I mean, you can just Google. The government has done a good job, I would say, especially with the big change healthcare, that was about a year ago, that breach that affected everybody. there are more and more resources out there for folks, and at least having a HIPAA security risk assessment, which is a defined thing. Although again, it's very large. Doing that and having that um, will help if there is a breach or an investigation. I mean, at least if I'm defending you, I can point to the fact that you've done something, right? And everything with compliance and HIPAA security. We can't eliminate all risks in this world,
Hmm.
right? But the people that really suffer are the agencies that have done nothing,
Hmm.
and they don't have any sort of paper trail. um OCR sends a letter that says, hey, we want to see what you've done in terms of HIPAA compliance. And if you can't show them anything, then that's just going to snowball and there's going to be more investigations. So from the security standpoint, I would say endeavor to conduct a HIPAA security risk assessment.
Okay.
um, there are, and unfortunately there aren't a lot of great resources in terms of consultants and that sort of thing out there um, to do this for
Hmm.
folks. And there are some, but it's very expensive. Um, but have HIPAA business associate agreements in place. You know, we all started to slack on that. Um, and I think that that's a very easy step. I've seen recently some where it was, well, quite a few, where it was a business associate that actually, sent the information to the wrong place. Well, if you don't have a business associate agreement effective and in place, then that's not a good start. So
Hmm.
that's kind of some low hanging fruit that you can do.
Gotcha. Well, let's go ahead and then get into the main reason that we're talking today. Last year, when we spoke, we talked about the state supplemental reimbursement programs. In Missouri, it's known as GEMT. I believe it's known as GEMT in some other states as well, known by other names in other states further. And we discussed how they were increasingly being looked at by the Office of the Inspector General. Um, since the Trump administration took over. Obviously, fraud, waste, and abuse has been a huge platform on which they've run and on which they are conducting their business. So, talk to us just briefly before we really get into specifics on what all this means for these state supplemental reimbursement programs.
Yeah. So, before Trump was elected, these programs were already on the OIG, and I assume everybody knows what the OIG is, on its radar. When there are items or issues that the HHS OIG views are a threat to Medicare, or are vulnerable to fraud and abuse to such a degree, they will put them on their, announce it and put them on their OIG annual work plan. And there are two items right now, or that have been on there for some time, that are related to EMS, emergency ambulance transports, and then the supplemental payment programs. And they announced, let's see, that was at Pinnacle a year and a half ago. I guess it's
Mm.
been about a year and a half that has officially been on the OIG work plan,
Right.
where they essentially said that uh, they don't think that states have been administering these programs in accordance with their established federal laws for and regulations and guidance for cost reports. And the OIG said, look, we think that these have been rolled out, and payments are being made, and states aren't running them appropriately. And so we are going to be investigating states to ensure that they are complying with all the federal rules. So um, those were already, had a target, a bullseye on them.
Hmm.
And that has been ongoing. It's, these investigations are always, they keep them pretty quiet. So it's hard to know exactly what's happening, but we believe there are certain states where they've been more active in the past year. Um, and, there could be, you and I are both located in Missouri. It's quite possible that Missouri is being looked at and we wouldn't even necessarily know what's going on. But they are targeting them. And as you mentioned in your opening, it's, these are the types of programs that both parties really haven't cared for a long time.
Hmm.
So I just expect, I expect the scrutiny to um, increase, certainly by all indications,
Yeah.
going forward.
Yeah, and there was an article published just earlier this week in Axios, which is another American political news website that was launched by some former journalists from Politico, who published the article that I read at the opening. That says state directed, and it's an article by Maya Goldman that says state directed Medicaid payments have grown rapidly, and there's been bipartisan support for reining them in, which emphasizes what you just told us about both parties not liking these particular programs. Paragon Health Institute, who we mentioned in the first article, they released a report that characterized state directed payments as legalized Medicaid money laundering. What do you make of that statement?
Yeah, I mean, and again, I'm not an expert on all of these. I'm not a healthcare policy wonk. Um, I got introduced into the cost reporting and that element that goes into these. That they're all designed to true up, right? The um, Medicaid payments and the cost of serving Medicaid. And as you know, I was in private equity and worked in the for-profit world for a long time. And when I got out of that, I wanted to be more involved in I felt like I was really an awful lot about making money and not so much about the healthcare. And so I went to work for community health centers and actually was general counsel and compliance officer for a while of the Betty Jean Kerr FQHC here in St. Louis that you might know. They have had to do this true up and cost reporting for years. So fortunately, I was exposed to that, and it's very similar to what we do in Missouri with the cost reporting in the GMT and in other states. That's slightly different. These other, initially they call them provider taxes, and now
Mm-hmm.
there's intergovernmental transfers and that sort of thing. But I know going back to when Obamacare was passed, that was a big target. Even in those days, Obama and his administration would call these schemes, and I believe Biden back then said these are schemes to just get more federal money. And then it's gone. Then it went to Trump's first administration, and they were targeting them. Um, and so yeah, there are nuances about how they work, but essentially it's viewed as the states gaming the system to get more money. Um, so there is a target, you know, on these. And I you've heard me say many times, we know Medicaid does not, their payments do not cover the cost of transports or operations, right?
Mm-hmm.
And I think these are a very good thing. Um, I do think that I agree with a lot of statements about these programs, and this is not just EMS. It's they hospitals or nursing homes. They get created for all sorts of different and oftentimes it is consultants and lobbyists that
Hmm.
work with the states to get these passed, they have a vested interest in making more money off of these things. Uh, a lot of times the consultants are working for the state and also working for the providers. Um, I think there's a fair amount of waste in these systems that should be eliminated or could be better addressed. Um, and I think it's something as an industry that we really need to look at. I've gotten the impression from a lot of people that, and especially when these get passed in states, that it's like, hey, free money,
Hmm.
you know, it's just more money. That's great. And um, it is helpful, but these are federal dollars.
Right.
It's federal healthcare dollars and big sums. And so people need to take that very seriously. And I'm rambling on a little bit, but I think a lot of this comes down to in the EMS industry, especially as there's been more focus on government-based EMS, is that the individual fire EMS needs we need to start taking more responsibility, honestly.
Hmm.
It's a change in mindset, you know. Um, but if I went into a room full of fire chiefs and I asked, how many of you are healthcare providers, I think very few would raise their hand, you
You're
know.
probably right.
But um, you're receiving Medicare and Medicaid dollars. Um, but we have trouble deciding what we're going to call ourselves as an industry, but CMS views us as a healthcare provider,
Right.
although they actually call us a supplier. Um, no different than a hospital or a doctor's office. And so when things like these supplemental payment programs come along, um, we need to take it seriously and not just be like, hey, this is more tax dollars, or this is these are federal payments that that the feds take very, very seriously.
Right. Yeah. The article goes on to state the Government Accountability Office and independent Medicaid advisors have both said in recent years that state directed payment arrangements need more oversight. So, for those of us who may not be really familiar with the government organizations, when we talk about GAO, the Government Accountability Office, and OIG, the Office of Inspector General, can you elaborate on what those two offices do? Do they work together? How does that work with those two agencies?
Um, yes, they do work together. Again, I guess there's a lot of shakeup and change.
Right.
Um, but one of the things that I've seen over the course of my it's 25 years of doing this now, and especially in the past 10 years, that I tell folks has really, really changed the regulatory and enforcement landscape as all these agencies work together much better. 10 years ago, they created Medicaid fraud units within each state that are required. And so, now Medicaid works much more closely at the state level than along with the feds. And so, you could have a Medicaid fraud investigation in Missouri that they're also going to loop in the OIG in Washington, D.C., um, maybe CMS. There's so many different agencies that are working together on this. I mean, I've had in investigations into fire departments just here in Missouri where we had investigators from the local U.S. Attorney's Office, from the FBI, from the local Office of Inspector General, that's working with the local U.S. attorney, who's working with the OIG attorney in Washington, D.C. Um, that's a lot of different agencies all involved in one case.
Right.
So they do work together very closely now.
So when we talk about the different payments, um, from the Paragon report, states collect funds from providers, then return those funds in the form of additional Medicaid spending. These expenditures garner federal matching funds, which are subsequently paid to providers through state directed payments, SDPs, and supplemental payments, which with states often keeping the portion of this additional money for other purposes. SDPs are payments that states direct insurers to make to providers. So, would that, I guess, when you say that the federal matching funds, obviously that is what raises the interest of these federal offices, the OIG, GAO, when they're talking about looking at these state supplemental payments. Is that correct?
Yes. Yeah. I mean, I think it's a combination of things. It's the use of federal funds. Um, with the EMS specific, I think that they have concerns about really just the payments themselves. You've been through the process,
Yes.
right? So, you have X number of Medicaid transports that you've done in a year, and you go through the cost report process, and you've got your revenue and your costs, and essentially it's a true up. um and so if you've lost money on the Medicaid transports, then let's say that's $600,000 over the course of a year. You get a $600,000 payment, and some of that goes, that's where you get into the intergovernmental transfers and that sort of thing. But
Right.
the main issue that has caught and this goes back several years, CMS issued a memo prior to the OIG putting this on their work plan that's 8 or 10 pages that details where they think states are falling short on these, and it really applies primarily to fire-based EMS, because you have to, the payments are for EMS only, right? It's just the way that the law is written, and so you have to break out the costs of fire and EMS, and there are federal rules on how to go about doing that. And for many years, I think that it was just done very loosely. And keep in mind, again, that the way this works is you get a consultant or lobbying lobbyists, and they get this passed for a state, and everyone in the state is really happy, and okay, we're going to get more money. But then it's essentially just dumped in Medicaid's lap, right? And so now these government workers who've been there forever have this whole new thing they got to do. And they don't necessarily have the means or the understanding to do it. And I think that that's been one of our problems as an industry, is we've gotten it passed and everybody's like, okay, this is great, but there wasn't follow through to make sure it was done correctly, from the outset. And so because it hasn't been, you know, I I I think it's very likely that there have been quite a few payments across all the states that don't meet all the requirements, and therefore, X fire department, maybe over the course of the past 5 years, has been getting $300,000 or $400,000 a year in these supplemental payments that they shouldn't be
Hmm.
if the cost reporting had been done correctly.
Right.
So, there's, we've got, it's kind of a double whammy. The feds don't like it, these programs in general, because they view it as gaming the system, to get more money, and it's complex. You've cited some good articles that, but also that it just hasn't been administered with proper oversight. To say that the money that has gone to these fire departments really truly covers the cost of the Medicaid services, right?
Right. And that's one of the frustrations as part of a fire-based EMS organization that I have, and one that I've shared with you on numerous occasions, is that from year to year they keep changing the goalposts
Yeah,
on what they want, and that kind of goes back to what you just mentioned a few moments ago. Whereas with fire-based EMS, breaking out the actual EMS costs, and I think some of the other fire-based EMS agencies that are in my area and with which you may be familiar probably share similar frustrations, in the sense that from year to year, the goalposts change as far as what they require. What they required for the end of one fiscal year is not they require even more for the next fiscal year. So and then we have situations where you and I work together on recoupments, where it mentions, like you say, they turn around and say, "Oh, we paid you hundreds of $1,000s too much. You need to pay us back." And then that involves another legal fight to try to prove that that money is something that we deserve. So
right.
yeah, it's frustrating the way that these
Yeah,
programs are
and
administered.
there's and again, several reasons for that. I think, and the first and foremost is that these weren't in a lot of states rolled out properly. And so, you and other fire departments are frustrated now that the rules are changing. Really, what's happening is they're catching up
Mhm.
with what the Fed said several years ago. You've got to be um, capturing all this documentation. You've got to, and it's built into all of these laws that there's audits. And I told folks, based on my experience doing this with community health centers and that sort of thing, is the real work begins at the time of audit. You do your very best when you submit the cost report to make it as accurate as possible, but there's always going to be an audit built in, and then there's a negotiation back and forth, and it's the way I like to operate is to take it very conservatively on the initial cost report, because in fact you can, in many cases, end up getting additional funds after the audit. Whereas our experience in Missouri is more often than not that people are returning money upon the audit. But really what's happening is that the states are just scrambling to try and make sure that they comply with federal requirements on these. So had they been doing this correctly from the outset, things wouldn't be changing as much as we're
Mhm.
seeing it. I really don't fault, um, for instance, what we're seeing in Missouri. I don't. They maybe could do a better job of explaining. They certainly could do a better job of explaining. Um, but I think that they really are attempting to make sure that they're complying with the federal rules that go along with this. Um, and another thing that I have argued or tried to argue is, again, I've done this with community health centers. Nursing homes have done this for a long time. There are experts out there. The rules are essentially the same. They're in the Code of Federal Regulations on how you do cost reports. Um, we need, as an industry, to be tapping into that expertise. Right? If we would have been doing that a little bit more 3 or 4 years ago, we we wouldn't be. I don't think we would have the same bullseye on us that we do right now, if that makes sense.
I think it does. So as we look to the future, um, obviously a lot of moving parts from day to day. What are some things that we can look for as far as different agencies just to kind of help keep ourselves covered, if you will, when we're submitting these cost reports?
On the reports specifically, um, uh, you know, I don't want to say on a national podcast things about certain certain groups, but I think it actually what it really boils back down to is we need to change the mentality as an industry of taking responsibility. The providers that I'm going to call us providers. So let's say your fire district, the board and everyone needs to not rely so heavily on consultants or blindly on consultants or billing companies and that sort of thing. But to one, as you know, I talk about compliance programs, you know, there's great resources out there. It's the one thing that the OIG says for all of these types of fraud and abuse, the basic compliance program is the starting point, right?
Mm-hmm.
And again, a compliance program is not going to eliminate all risk, but what it does is it gets the agency and the organization thinking about these things, right? And thinking about cost reports and federal payments and that sort of thing. Um, I expect, I said that we have been on the OIG's watch list on their on their annual list for my guys in different versions for 2 decades now. They're going to continue to look at our billing. Um, you know, with ambulance services and CMS, we only bill for 4 different levels. ALS, we got BLS emergency, BLS non-emergency, ALS emergency, and ALS non-emergency. I don't know if it's CMS specifically. They publish each year all the different Part B services. Imagine all the different Part B services that are billed to Medicare, and they rank them with the most improper payments. Ambulance falls in the top 10 year after year after year.
Mm-hmm.
Why is that? I mean, it's not really all that complicated, right? So we still
Right.
have a target on us. That's not going to go anywhere. Um, we've got a target with the supplemental payments. I hope that they don't go away. Um, but again, somehow as an industry, and I don't know if it's through local associations, we start at the state, like with the Missouri fire chiefs, and start getting this word out that look, we've we've got to be compliant. We got to pay attention to this stuff, sort of at a ground, roots level, so that we've got board members that are thinking about this, that are
Mm-hmm.
thinking about their Medicare payments and paying attention to that sort of thing, and providing more uh, oversight of your consultants and the outside parties. That's where I see a lot of people. One of the biggest mistakes is that fire departments think, well, I've hired billing company, and it's not like hiring a law firm where if you hire me, you can hide behind me and blame me for things, right? The feds don't care when they come in to look at you. They don't care who your billing company is. They probably don't even know who your billing company is. They don't care who your consultant was who prepared your cost report. All they care about is that you, fire department, did it correctly.
Mm-hmm.
And it's technically, we'll try and make a defense that you relied on somebody else, but it's very slim. So people need to realize. I hear all the time, compliance and billing. Oh, we've hired so and so big national billing company. We've got that covered. Uh, Man, you need to be paying attention to what they're doing and
Right.
have oversight for them. Um, and I think that that's something that as an industry we need to change the mindset on.
Yeah. And that was going to be one of my next questions was how often do you see where, and you've talked about compliance on numerous occasions in the last 30 to 40 minutes that we've been talking. How many times do you run across a situation where you mentioned billing companies and you ask, do you have compliance in place? And they say, oh, our billing company handles that. Well, they don't handle compliance they handle compliance for themselves, for the billing company, but they're not handling compliance for the agency they're billing. Is that correct?
Right. I mean, that's 100% correct. If you go, if you go out and look at the OIG compliance guidance, they've updated their general compliance guidance, which is very good. And then over the past 20 years, they've issued, industry or segment specific compliance guidance for like durable medical equipment, nursing homes. One of the earliest being ambulance in 2003. They also have compliance program guidance for third party billing companies. So that tells you right there, you know, the billing company has their compliance program. You're supposed to have your compliance program. Um, and, these things again are not complex, but I see it over and over again. And again, it's the way that the industry has operated for a long time. And I don't fault folks because, the feds weren't paying attention much until the past 5+ years.
Mhm.
And look, I've actually operated a for-profit billing company before. One of the things that we're going to sell is compliance, that we're going to cut, but we mix terms, right? They're saying that they're going to have staff that build this compliantly and that sort of thing, but that's not a compliance program that has the 7 elements of a compliance program that you need for the oversight. So when they're saying we've got you covered in terms of compliance, it's just simply not the case. Um, and there are plenty of really good billing companies out there. It's also it's a difficult business. There's a lot
Yeah.
of turnover.
Yeah.
And just because it's a name that everybody recognizes doesn't mean that they're doing a perfect job. One of
Right.
the things that I run into all the time is, we'll do an audit and find issues with claims and stuff. Well, it turns out it's one or two employees that have been working assigned to X fire department doing all their claims, and those employees happen to be doing a particularly bad job. So it only
Mhm.
takes one or two within, but if those couple of employees are doing a bad job for a full year and you've been billing claims inappropriately, the feds don't care about the billing company. They care that fire department's been billing claims inappropriately, right?
Right. Right.
Um, so that's where we have a real breakdown, and people need to be taking more ownership of that sort of thing.
Yeah. Earlier in our conversation, you talked about the intergovernmental transfers. You also talked about the government uh, providers, fire-based EMS. One of the excerpts from the Paragon report that's quoted in the article by Maya Goldman, when Congress made those schemes somewhat more difficult in the early 1990s, states turned to intergovernmental transfers to finance the state share of Medicaid. Through an IGT, a local government or government-owned provider transfers money to the state that the state then uses to make such higher Medicaid payments on providers, which are often the very same providers that make the IGT. IGTs raise significant conflict of interest concerns and result in government owned providers receiving favorable treatment over private providers. And I think earlier in our conversation, you mentioned some things about conflicts of interest. You mentioned specifically government owned or government providers and the IGTs. So, and you've mentioned that it's been on uh, the OIG's radar, or it's something with 5 years or more. So this goes back to last century that these things have kind of been looked at as maybe not on. I don't want to say not on the up and up, but somewhat suspicious, if you will.
Yeah, yeah, it's heck, I work in different states, and every once in a while I have to ask myself, and you and I have looked at this, like, okay, we've got now it's been audited and we've already paid X amount of the intergovernmental transfer, but now this is changing. So does the intergovernmental transfer amount change to,
Mm-hmm.
I mean, it is complex, and it's really money just sort of passing back and forth, right?
Right.
And the way it's set up in Missouri and it took folks a while to understand. It's like, okay, hey, you've got to pay $250,000, but don't worry, because you're getting that money back plus more money.
Right.
And so to like city finance directors, they're like, wait a minute, what? We got to pay out money, and yeah, okay, you're going to get it back. Um, so uh, yeah, it is suspect. And again, I think that they're good programs. We need to make sure that we are trying to eliminate the waste, and I won't even say fraud, but the waste and abuse. And frankly, the way a lot of them are set up, it doesn't take I've been looking at this with some people that I've worked with in healthcare that are outside of EMS, some healthcare finance people that are looking at some of these, and immediately they look at it and they go, well, the fire departments that are the least efficient are the ones that get the most money. And I'm like, yeah, pretty much
Mm-hmm.
so, you know. Um, so there are reasons why there um, are people that are looking at that. And so maybe we keep these programs, but there's some changes to the cost reporting or how it's done. I'm hopeful that they don't go away. I've seen quotes recently because there's been so much talk about this is and if the associations keep lobbying, that's a good thing. I mean, ultimately, our representatives don't want to be responsible for payments going away to, not-for-profit hospitals or fire departments
Right.
and that sort of thing. But I think we need to be prepared when we're making this argument for these payments not to go away. Of let's provide some proactive input on how we can make it less
Mm-hmm.
wasteful and more efficient.
Right. So when states talk about Medicaid expansion, obviously with what we've been reading, what we've discussing, that's going to be a tough road to hoe. But when Medicaid expansion is discussed, is that something that might address some of the shortfalls like we've been talking about? I mean, in the report, it's a quote from the CEO of the Federation of American Hospitals uh, that says provider taxes and state directed payments provide means to offset the crippling underpayment by Medicaid. So is that something that Medicaid expansion can address, or is that just a pipe dream for those that think that Medicaid expansion is going to help offset those costs for different providers, whether they're pre-hospital or in hospital?
Yeah, I mean, my gosh, people have been debating that
Okay.
for a long time. You know, they what I keep hearing is, that they can come up with this money by eliminating the fraud, waste, and abuse. There is, so I definitely think we're going to see more enforcement. We haven't really gotten into that of more audits of our claims and um, more oversight, more investigations. That's where they're going to start because that's the, it's already in place. I know that I think it's Assistant U.S. Attorney recently said with the False Claims Act, which is what they use to go after folks, that something along the lines that it's the most powerful tool in their arsenal and it's not going anywhere, and they're going to continue to use that. So I think, in what we'll see in the next 6 months is an uptick in more of that audits and that sort of thing. How they come up with the rest of the, I mean, I don't think that you're going to get to, what is it, 800 billion.
Yeah, I think 800, yeah, $880 billion.
Yeah, I don't think you're going to get there um just through that, but how they make up for it, I'm not sure. And honestly, like I said, I'm not policy expert in terms of like GMT. uh I don't know. I'm not sure they can just snap their fingers and make that go away, right? I mean,
Yeah.
maybe they eliminate it over the course of a couple of years. Um, but that's written into Missouri law, for instance.
Hmm.
So it there's it's going to be a really interesting next 6 months to a year to
Yeah.
see what shakes out.
Yeah, and you're talking about big money here. The state directed payments in 2024 exceeded 110 billion dollars. The previous year, 2023, 57 billion dollars. So that's a lot of money that's on the table that's being distributed by these states.
Right, right. Yeah. And I don't know what I want to say in Missouri, just on the GMT, it's like 30 or 40 million dollars a year.
Hmm.
Um, of now, I mean, that's small potatoes, but and not even half of the eligible departments are even participating in that. So, if you look at like Texas and California and some of these other states, that money would add up quickly
Yes.
when
Yeah, I
we're
was.
just talking about the EMS side of
Oh
it.
yeah, I was looking at an email from last month where they were talking about Texas in particular, and I think the like cities like Houston, San Antonio, they're getting 12, 14 million dollar payments just for one city. So yeah, it's a lot of it's a lot of money.
Right, right.
So what can is other than just being aware, um, keeping up with what's happening as far as the government level, what can some agencies do as far as just to keep on top of things when we're dealing with these state supplemental payments, GEMT, and all the changes that we're seeing almost daily, weekly for sure.
Yeah. I think the first thing that comes to mind for me, and you've heard me say this before, is when when you're audited, when an audit occurs and there's a demand to, if there is a demand to return money or recoupment, don't just simply give that money back.
Hmm.
It usually comes on an official looking, from the state that says, hey, we've audited, you're required to pay back $200,000. That's really, like I said, that's really when the work begins. And a lot of times those audits are incorrect. And this is not just an EMS. Again, my real experience is with the community health centers. It's true there too, where sometimes they come back and say, hey, you've got to pay us back $1 million. And by the time you're done going back and forth and providing more documents, you end up getting an extra $200,000. Right. So
Right.
that's a very easy step. And you may have to involve your council, fire departments. Don't just look to your consultants, because the consultants are the ones who prepared it. Include your council and say, hey, do we legally have to pay this back? and and then analyze and really dive into it to find out whether you have to pay it back. And so I say that for a couple of reasons. One, a lot of times, as you and I know from specifically from personal experience, is they're completely wrong, and you might return several $100,000 that you didn't need to. The
Right.
second thing that's really concerning to me is we know that the feds are looking at this. So let's just take the state of Missouri, since we're both here. And if you're a fire department that has, for the past 5 years, returned $100,000 a year after audit, if I'm an assistant U.S. attorney looking at that and I'm investigating, or I'm the OIG, what's the first thing that that says to me? It says to me that you have been submitting improper cost reports and claiming too much money and getting improper payments.
Right.
Um, and again, that goes back to the oversight and the responsibility because, um, you know, so don't just simply give the money back, right? Because
Right.
to me, that's really almost an admission that, yeah, we didn't do it
Mm.
correctly. We didn't provide the proper documentation to support this, which, if I'm a U.S. attorney that wants to make a false claims case against you, you've essentially admitted that that you filed this improper cost report and got several $100,000 and did it inappropriately,
Right.
right?
Right.
So so be cautious about just returning the money. That's one easy step.
Okay. Okay. Well, as we get ready to wrap up, want to thank you again, Kevin, for your time and your insight. Um, for those out there curious, what are some resources that you can offer? Do you have any tips or tricks, if you will, places to go to find out more about uh, this information that we've discussed, these cost reports, perhaps in engaging your firm in compliance?
Um, anybody listening can certainly reach out to me at Fairley Law. It's my law firm. As you know, we also have emscompliance.com, which provides compliance programs, is not really directly involved in the cost reporting, although we do, provide some advice and that sort of
Mhm.
thing. But um, folks can reach out to me, at the law firm if you have questions on this. Um, and that's fairlylaw.llc.com, or Fairley at fairleyllc.com. I'm happy to advise you. Unfortunately, there aren't, I can't point you to a lot of great like association
Okay.
sites, or
Mhm.
because again, um, there are a lot of consultants that are involved in this that have a vested interest in making as much money as possible off of this, and no fault to them, they're for profit. But a great, I think that's something that we really as an industry need to talk about, is where are some better resources
Yeah,
for folks. And I wish I had a better answer for you. Um, but I really don't. But I'm happy, as you know, I'm always happy to talk with folks and try and assist.
absolutely. Yes, he is. I can attest 100% to that. Um, so thank you, Kevin. Again, appreciate your time. Appreciate the information. Hopefully, by the time we talk again, we may have some more better answers on some of the questions and some of the items that we've discussed. Want to thank you all out there listening for joining us. If you want to get in touch with us, we are on Instagram, not_a_fib_podcast. That's our Instagram handle. We're available by email, not.a.fib.podcast@gmail.com. Want to thank you again for joining us. Take care, and we'll talk again next month.